Okay, we're live. Good. Perfect.
Perfect. Yes.
I'm hearing some feedback, Priti. Are you?
Okay.
Um,
Hang
just
on.
wondering if we need to mute something.
Yes, probably.
Don't mute that because now no one can hear you.
Okay.
Maybe we're okay.
Maybe we're okay.
If anyone
If
can
anyone
comment and let us know
comment,
if you're having some trouble hearing us, let us know and we will try to fix it. Um, but today we are going to talk about dizziness and aging. Um, and imbalance and vertigo and all the things that can creep up as we age. So I'm Lauren Wooten. I'm a vestibular physiotherapist, and I work with the Vertigo Therapist is the name of my clinic. And Preeti, do you want to introduce yourself?
yes. Hello, everyone. My name is Priti, and I'm a vestibular therapist, and I'm the founder of the Dizziness and Balance Clinic. So we both have joined here to talk about vertigo, dizziness, imbalance, and aging. So it's a very, very interesting topic, very vast topic. So we will try to cover a few points, most important points, in whatever time we have. And if you guys have any questions, just let us know, and we will be happy to answer them. Okay.
Great.
So
So the first question we were going to talk about, or Preeti, maybe you can answer this, is how common is dizziness, vertigo, and imbalance in seniors, and is it a normal part of aging?
yes, so as we age, the incidences or the chances of getting dizziness or vertigo rises significantly. So just to let you know that the vertigo sensation, dizziness can be at least 28 to 30% over the age of 70 years. So that's how much people can feel dizziness. And then the other vestibular conditions like PPPV can increase to up to 40% over the age of 65 years. So it is very common. And is it normal? I would not say it's not normal. It is definitely the interplay of various balance systems that are not working together that's causing the dizziness, or interplay of a variety of systems, which Lauren can talk about, which all systems can be affected in during with aging, and then that can lead to dizziness. So yeah.
Hmm. Hmm. Yeah, and it's a pretty big concern, especially in as we age, because the concern is with dizziness and imbalance. The concern is falling, right? So if you're imbalanced at it, and you get up in the night to go to the bathroom, oh, that you fixed the feedback. That sounds much better.
Oh,
um,
good.
getting the echo in my ear. I was like, I don't know if I can do the whole talk like this, but I'll try.
Yeah.
Um, okay, so yeah, so falls. So we want to make sure that people with dizziness and imbalance are treated properly and helped, because with this condition there is a higher rate of falls, and with falls, as we know, it can just cause a cascade of issues, ending up in hospital because of broken bones, and then so on and so forth, where outcomes can get really bad. So that's something we definitely want to address. Um,
Yeah.
so I think you were asking, Preeti, which which systems are affected. So your vestibular, or sorry, your balance system. Oh, I just had a note here saying that I am echoing. So I am still hearing a bit of an echo, actually, Preeti. I don't know if you can turn down any other volumes that might be
So
coming
let's
out.
see. How's that?
Is that still
Oh,
echoing a little bit?
I can't hear myself then. Oh,
I'll
maybe
just
I can.
keep
So
chatting as you try to work it. Oh,
try
that
to
made
work.
it
Oh, that made it worse. Oh, sorry.
worse.
How's that?
That's good, I think. Yes. Okay,
Good.
let's keep going. I think that's good.
Okay.
So we were talking about what systems are affected. So we have our balance system, which takes basically our brain uses many different sensory systems to try to figure out where we are in space. So we use our visual system to tell us where our body is in space. We use our inner ear vestibular system to tell us where our body is in space. And we use our somatosensory system, or our sense of touch, to help us figure out where we are. So as we age, all three of those systems can actually start to see changes and just less sensitivity, a little bit of a decline in those systems, especially in the inner ear. They've shown that the little hair cells in your inner ear that are detecting motion start to deteriorate, and you have less number of them. There's less neurons in the inner ear as well. And so that causes your
Yeah.
vestibular system to be less sensitive.
Couple of things that I would like to add is, as we age, our musculoskeletal system also weakens. So like less muscle mass, joint arthritis, so pain. So musculoskeletal skeletal system also plays an important role in older adults, because as we age, that's going to be get affected. Plus the central nervous system, so your brain. So there's neuronal loss in the brain too. So we have to add these two systems as well into the balance. Impairments. Our video is paused. Oh, we're back again. Into the balance impairment. So we have to tackle not just the vestibular system, but also other multi-system as well.
Exactly. Yeah.
Mhm.
So we can talk a little bit about what vestibular conditions are most common in an older population. So basically, there is a general decline as you age in the strength of your vestibular system and all of those other systems we talked about. But as you age, there's also a increase likelihood of getting some of these vestibular conditions. Such as BPPV. So that's one that we talk about a lot because it is a very common vestibular condition, and it gets more and more prevalent as we age. I don't know if I have a statistic here. There was a report that about 50% of elderly patients with chronic dizziness who visited an emergency room showed some nystagmus that was indicative of BPPV. So it can be as much as 50% of elderly, who have dizziness may have an underlying condition of BPPV.
Mhm.
Did you want to add to that, Priti?
Yeah, so it is very important as vestibular therapists for us to rule out BPPV, even if the patient is not complaining, even if an older adult is not complaining of vertigo. So like spinning sensation, if they don't complain, we still have to rule out and we still have to treat that. So very important. Yes.
Yeah. I think we were talking about before the call how sometimes in older patients, they don't have the same feeling as of that rotational kind of spinning sensation. They may have more vague kind of symptoms like some lightheadedness, some dizziness, unsteadiness, difficulty with quick movements, things like that.
Yeah.
And those aren't typically what we see with BPPV in a younger population, but
Mhm.
it may be BPPV that's actually causing those symptoms. So, definitely ruling that out. It's an easy kind of positional test to rule in and out whether somebody has BPPV. And it's one of those things that can be treated so easily, usually, and quickly, and really prevent a lot of further symptoms and prevent, potential injury and whatnot down the road.
Yep. So we talked about BPPV, and so it's not just limited to that. There are
Right.
other vestibular conditions like an older adult can get neuritis, post shingle, inflammation of the vestibular nerve. They can get that. Then Meniere's disease. So we all know that Meniere's disease is very common in the younger population, but it can occur in the later stage of life as well.
Mm-hmm.
So we have to keep that in mind too. Plus, other neurodegenerative diseases can give them dizziness too. So we have to keep that in mind.
Mm-hmm.
Um, what were
And
the other?
yeah, there was. I'm just looking at the chart here. So one thing that is a lot more concerning would be a stroke. So that is something that
Yeah.
obviously your increased risk as you age. So making sure that if it is a new type of symptom that you're experiencing and it's sudden and you have associated weakness or any other headache, any of those other type of stroke symptoms, that you definitely going to the emergency room as fast as possible.
Mhm.
um, and TIA as well, so transient ischemic attack can cause dizziness as well. So making sure that your provider's aware if you're having any of these symptoms, and they can check for that.
Yeah, and the other thing, vestibular migraines. Yes, so Migraines can also affect older adults quite a bit.
Hmm.
So, a proper history taking is very important, and not just ignoring them, that if they complain of headaches, or if they complain of balance problem, or if they complain of dizziness, it can be very, very vague symptoms. So we have to put together all their complaints and assess them to diagnose properly what are they dealing with.
Exactly.
uh, did we talk about medications? Yes. Yeah.
Yeah. So medications, I get that question all the time from my patients. Can medications cause dizziness? And the short answer is yes. If you look on any side effect list of most medications, dizziness is on there. The way I explain it to my patients is that it's usually a rare side effect. In a lot of times, it just has to be on there because when they did the trials, 1 person in 1,000 had dizziness, so they had to put it on the label, kind of thing. So um, dizziness can be caused by medication. So what I usually tell people is think back to when your dizziness started. Did it start somewhere within a month or so of starting any medication? That could be a link. And then, as a physiotherapist, we can't recommend that you start or stop medications. That's just not in our scope of practice.
Absolutely.
But
Yeah.
we can say, talk to your primary care physician about potentially, really the only way that we'll know if the medication is causing dizziness is if you stop taking the medication and your dizziness goes away. So, or reduce the dose or something like that. So that's, dosing. You need to talk to your doctor about trying, maybe you need to switch to a different medication. Blood pressure medications are one of them that can cause dizziness, because what they're doing is they're lowering your blood pressure. And sometimes if your blood pressure is too low, you get lightheaded. So
Lightheaded. Yeah.
yeah, so that's one sign. Um,
Mhm.
and certain other medications can have kind of cognitive effects, so make you feel a little foggy and dizzy. So certainly that's something to consider, and really a trial and error of going off of it and seeing if it helps,
Yeah.
if you want to do that.
Yeah, so if you read any of the balance literature, balance impairments literature, they will always talk about polypharmacy. So if you're on multiple medications, then there are high chances for you to get dizziness because there's an interaction of the medications, and it increases the risk of falls as well in these patients with polypharmacy. So make sure to talk to your doctor about the medications if you're starting to feel sudden onset or new onset dizziness. Okay.
Yeah.
The other thing is you can get just the age related changes in the vestibular system without any other primary conditions. So, just the age related changes in your eyes, in your ears, your sensory system, so lack of sensation in your feet. This is all going to affect, can give you vertigo, dizziness, and imbalance sensation. So it's a multimodal balance disorder that we are talking about without any specific cause, but just the age related decline in the function of these system.
Yeah. So just because you have, just because it can be a normal part of aging, and these normal declines in these systems, doesn't mean that you have to live with it,
No.
right, Priti? You can, a
Yeah.
lot of patients will say, well, it's just a normal part of aging, so this is it. I just have to learn to live with it. Not necessarily. There are things we can do. Um, to help. So we can start to use other sensory systems more. We can strengthen other, certain sensory systems, and work around, deficits that you have, to be able,
Mhm.
so that you can participate and do the things you enjoy with less symptoms.
Yeah. So if you're starting to experience balance problems, unsteadiness, balance, that kind of thing, and if you're over the age of 65, definitely go see a vestibular therapist, and they're going to do a detailed assessment of all the possible systems that they can look at, like your somatosensory system, vestibular system, a part of the visual system, your neurological, so cognitive, neurological assessment, and then they can come to a comprehensive plan to how to improve your balance, and it can be improved. Definitely it is, like you said, that if you're getting the age related decline doesn't mean that you can't overcome it. So a nice vestibular rehab program will help,
Hmm.
and Lauren can talk more about it, what we're going to do in vestibular rehab.
Yeah. So some common exercises that we will use. I mean, it's going to be very individualized to you and what you're having difficulty with, and sort of what you need to work on. But generally, a lot of times I'll work on balance. So a common exercise, or a really great exercise that you can try at home, would be a something we call a Romberg. So what you would do is you'd stand with your feet together to touch. So if these are my feet, I'm not going to stand up because you won't be able to see my feet, but standing with your feet together, and then put your hands on a countertop or on the back of a chair or at your sink, and then try to close your eyes and see if you can let go of the sink. So having your eyes closed while you're doing a balance exercise takes your vision out of the equation. A lot of time, as our vestibular system gets weaker, our vision starts to take over a little bit more, and we use our vision a lot more to orient ourselves, and use non-station, or so you use stationary objects to try to orient ourselves and tell our brain where we are in space. So if we're using our vision a lot, and we're not using our vestibular system a lot, this exercise actually takes your vision out, makes you focus more on what you're feeling under your feet, your sensation, and your vestibular system, and is a great way to train your balance. So what I would do is have someone stand with their eyes closed, hands close to something in case they start to feel that they're off balance. People might start to feel themselves sway a little bit in this position, and some people get really nervous about that, and they say, oh, I feel like I'm swaying, but there's actually a normal amount of sway in this in any healthy individual. So swaying is not a bad sign. Losing, having to step, having to touch is a sign that your balance is affected. So practicing that, trying to get up to 5 seconds, trying to get up to 10 seconds, 20 seconds is usually sort of 20 or 30 seconds is what you can try to aim for. And that's a great way to work on your balance.
To work on the balance, yeah.
Mm-hmm.
And if vestibular therapy is not just the balance therapy, so once we assess, we'll come to know if you have BPPV, then we're going to do some repositioning maneuvers, get that crystals in position, and then work on your balance again. Then if you have just the dizziness, then habituation exercises can help. The adaptation exercises that can help. So a comprehensive plan can help decrease your dizziness sensation. Lower leg strengthening is very, very important. Lower limb strengthening is very important in maintaining your good balance and feeling of less unsteady.
Mm-hmm.
So unsteadiness feeling, and then decreasing the risk of falls as well in these
Yeah.
patients.
Yeah, another exercise actually that I often give patients who have declining vestibular system is if you're someone who has trouble with quick movements. So if you have trouble kind of turning quickly, or sometimes my patients will say, in the kitchen when I'm turning or putting dishes away, or big head movements and things like that, that can be a sign that your vestibulo-ocular reflex is a little bit weakened and needs to be strengthened. So, okay, let's just see if my signal comes back here. You've paused there, Priti, but let's see if it comes back. Sorry, everyone.
That's me.
Okay, Priti's paused, but I think I'm still good, so I'm going to keep talking. So what was I saying? Right. So the vestibulo-ocular reflex exercise is one.
My internet connection is very poor.
I'm just going to mute her there. There's one exercise that we can do where you look at an object. I'm just going to hold my thumb out in front of me like this, and I'm going to turn my head side to side while I focus on my thumb. That is training my vestibulo-ocular reflex. That's a kind of coordination between my eyes and my brain. And that coordination, when I turn my head to the right quickly, my eyes have to make a compensatory movement to the left, so that to keep focus on my thumb. So I turn my head to the right, my eyes move to the left. That's actually a function of your inner ear, and a reflex between your inner ear and your eyes as they communicate together. So that ability to keep focused on something as you move quickly and maintain your balance as you move quickly is a visual and vestibular kind of integrated sort of thing. So what we do is we do exercises where we have you focus on something and turn your head quickly while you focus on it to try to strengthen that vestibulo-ocular reflex. I think we lost Priti. Unfortunately, she's out of town right now, so I think her internet connection maybe isn't as strong as it is when she's at home. But I'll finish up here, and maybe she'll be able to pop back on. Where were we? So talking about management. We talked about kind of strengthening balance exercises, visual coordination exercises, and then the last thing and a really important thing is that as we age, we tend to move less. So increasing our movement and maintaining the amount of movement that we do. So getting out for walks, going out and doing sports, if not necessarily going to be playing football and rugby anymore, but you might be able to go and learn a new sport like pickleball or tennis or something like that. Getting out in some fresh air and walking. If walking is a challenge for you and makes you dizzy, using something to walk with. Sometimes I'll get my patients to get a set of those poles, the Nordic poles, and that can really give them some confidence in getting out and walking. So movement is medicine. Get moving, get your cardiovascular system going, and you may find that you help your dizziness in that sense. I'm going to go to some questions. There's a few questions coming in on Instagram and Facebook, so I'll start to answer those if I can. I have what to do with the fainting feeling, the most horrible symptom to me and feels so real. So a feeling of, a fainting feeling might be hard to know what, I mean, dizziness is such a hard thing to describe to people. So it's hard for me to know kind of what you mean by just a fainting feeling. But if it's a feeling as if you're going to pass out, that could be a blood pressure issue. Or if it's more of like a falling feeling, that's more of a vestibular feeling. So if you feel like, the floor is dropping out from under you or something like that, definitely vestibular exercises can help with that. So doing the balance and visual exercises, working with a vestibular therapist, even if it is more of a blood pressure issue or cardiovascular issue, and you're just not sure, working with a health professional, either your doctor or a vestibular therapist, can help you determine. So we can take your blood pressure and get you doing things in different positions to see if that's to kind of see what the cause of that is. Let's see if there's any other questions that have come through. There's one that came through on Facebook. Says, what about the barometer pressure? Find you're more lightheadedly dizzy and a little bit when the pressure is up and down. Is that normal? I was diagnosed with vestibular neuritis 6 years ago and 7 years, 6 years ago, 7 years ago. So vestibular neuritis is the condition where the inner ear nerve has a virus that affects the nerve. So it can cause dizziness. Obviously, it can definitely barometric pressure is one that a lot of people will find their symptoms are worse when the pressure is low, I think it is. So when there's a storm coming, when there's a rainy day and that kind of thing. And yeah, anything that affects pressure, because, your inner ear is affected by pressure. So increase or decrease in pressure can cause symptoms. What can you do about that? That's a tricky one. We can't really change the pressure or prevent pressure changes, but a lot of times what I find with patients with vestibular conditions is that oh, did we get Priti back? Hang on one second. She might be back on Instagram. Oh, there she is. I see her here. Hi.
Hi. I cannot connect to Instagram,
I
but
saw
I think
you
so.
briefly.
Yeah.
Okay.
It's the internet problem. Sorry, people.
No worries.
Yeah.
We I think the video ended on Instagram, but I think we're still on here. So I went through kind of a little bit more management, and then I was starting to answer questions. So someone asked a question about pressure changes in the environment and dizziness. So I was explaining that we can't stop pressure changes in the environment, but sometimes what I find with people with vestibular problems that is that it's sometimes like a buildup of several different triggers. And so if we can
Hmm.
find some of those triggers that we can manage, then, and reduce those triggers that we can manage, then those other triggers, you're at a little bit lower bar when the barometer goes. And if you've had a good night's sleep and you're hydrated and, those types of things, a low pressure system may not affect you as much as it would if you were already tired and already, this, that, and the other kind of trigger. So that's sort of, what we can say about that.
Absolutely.
Yeah. There weren't any other questions that have come through yet, but if anybody
I
has
can
any
I
questions,
I can see one question
oh, go ahead.
probably, or like, so always I feel that I'm on a boat and that I'm ready to pass out, but it has never happened. So the person has never passed out. And also there is light and noise sensitivity. I can only see a something on Instagram, not clearly because
Okay.
it got disconnected.
Yeah. So, so that feeling, so is it when she's on it? Oh, she feels like she's on a boat.
She
This might have
feels
been
like
a
she's on a
follow up
boat.
to the follow up to the question that I did answer, because she was saying that she has a fainting feeling. Um, so that does sound somewhat vestibular. Oh, hang on, it keeps pausing. Okay, I think I'm going to end this. Um, so what can we do about that? I mean, getting a proper diagnosis is going to be one of the key things. So, what is causing that fainting feeling? Do you have BPPV potentially, especially if you're an older adult, and you're not necessarily having room spinning vertigo? You may just have this rocking sensation or this, some other random symptoms that don't necessarily line
Yeah.
up. So, getting BPPV ruled out is going to be your first step. And a vestibular therapist sometimes, family doctors can do that as well. If it's not that, determining what kind of other causes could be. Sometimes vestibular migraine is one that can cause those types of symptoms, or PPPD is another one that can cause that type of kind of constant low level dizziness. And then, we can't really recommend any treatment right now because we don't know what the cause is. But once the cause is determined, coming up with a treatment plan around that, whether it's medications or vestibular rehab, or lifestyle changes that are going to help you.
Hmm. I
I don't think we have any
totally.
other questions, and we're at our kind of half hour mark, so we can sort of wrap up now, I think, unless you wanted to
Yes.
add anything else, Preeti.
Um, no, I think so. I think so. We covered most of the points, right?
Yeah, I think so. So thanks everyone
Yeah,
for
yeah.
joining us. This was a good talk. This was one that was chosen by my email audience. So if any of you are on my email list, you helped kind of choose this topic. It actually surprised both of us that people really were interested in this dizziness and aging topic, and so it made us kind of have to do a little
Oh,
bit
sorry.
more.
One thing,
Yeah.
Lauren, did we cover about the aging, like as if you have a vestibular condition when you were younger, like less than 60, and then as you age? Did we
No,
cover
I did.
that part?
I didn't. So if you want to ask that, so I'll ask you the question because I know that was something you wanted to cover, Preeti. So here's a question that we wanted to answer for you guys, because it's a question that sometimes people will ask us. When you have a vestibular condition and you're older, so let's say you have BVPV or certain conditions, do you experience it differently than you would as if you were younger? That's the question, right? So go ahead.
Yeah, yeah, absolutely. So the symptoms which a younger person can experience will be quite different when you get older as well. And uh, actually, the question is like, can it get worse as we age? uh, our vestibular system, when it ages, it will age mostly symmetrically, right? So the aging, as we age, the brain gets chance to compensate it very well. So a lot of these patients with history of neuritis in younger years, they won't even come to know that the vestibular system is, there's some changes happening in the vestibular system. But the effects of it can be some balance problem, but not actual the vertigo sensation, because the brain has gotten chance to compensate it symmetrically. So there can be some difference in that. Plus also, um, if you got, for example, if you've got vestibular neuritis, um, sometime in your life, and like 10 years down the line, can the neuritis come back again? It won't. Can it get worse? May I want to use the word maybe, but it won't get worse as well. The neuritis is itself won't get worse. The neuronal loss that happens, that's static. And then if you can get if you are getting the age related changes in the neuronal loss, that will happen symmetrically. So both the ears can go down symmetrically. So there'll be some asymmetrical changes, but yes, there'll be difference in those vestibular conditions as you age. One good thing about the migraines is when you have migraines, obviously mostly younger population has migraine. As we cross menopause, the migraines tends to settle down, but it might change into something else as well. Uh, the vestibular migraines can come back to
Yeah,
you. So
that's a good
there's
point.
this plus and minus. Yeah.
Actually, before you even said that, I was going to bring that up because someone just commented, and Jennifer said, "Can imbalance disorder be a part of menopause?" And what I wanted to say was, usually, yes, I do see as we approach menopause or perimenopause, a lot of my patients around that age will have an increase in symptoms. A lot of times, it's my patients who have a history of migraine. And they may have had a history of, typical headache, migraine, in their 20s and 30s, and then into their 40s they get less less kind of headache migraine attacks, and then they start to get some of these vertigo attacks. And sometimes it's hard to associate it, but it may be that your migraine has not gone away. It's changing. So it's changing
It's
from
changing.
a typical migraine now to a vestibular migraine. Um, and causes those migraine attacks that can have balance and dizziness and whatnot in between attacks as well. So certainly something to think about. And if Jennifer, if you have a history of migraines, that could be what's going on. And even if you don't have a history of migraine, just giant um, um, hormone fluctuations can trigger
Fluctuations,
vertigo.
yes.
Yeah.
Hmm. Yes. Okay, perfect. That's it.
That's it. Yeah. Okay. We're going to leave it there, but we'll definitely do
Yeah.
another one of these in the next month or so. And,
Hmm.
Jennifer does have a history of migraines. So, yes,
Okay.
definitely send us a message if you want to chat more about that.
Yeah.
Definitely, I'm reachable at my website is thevertigotherapist.com. So you can go there if you're interested in more information, or follow us both on Facebook and Instagram for more
Yeah.
information and tips, and more of these lives coming up with different topics.
Different topics. Yes.
All
Okay.
right. Thanks, everyone. Have a great
Thank
rest of
you,
your day.
everyone.
Okay. Bye
Bye
bye.
bye.